Hypersomnia, overview. Hypersomnia is a condition in which you feel extreme daytime sleepiness despite getting sleep that should be adequate, or more than adequate. If you have hypersomnia, you fall asleep several times during the day. Hypersomnia affects your ability to function at work and socially, affects your quality of life and increases your chance of accidents. Signs and symptoms of hypersomnia include constant, recurrent episodes of extreme sleepiness during the day. Sleeping longer than average, 10 or more hours, yet still being very sleepy during the day and having difficulty remaining awake during the day. Researchers have looked at the potential roles of neurotransmitters in the brain and cerebrospinal fluid including hypocretin/orexin, dopamine, histamine, serotonin and gamma-aminobutyric acid, GABA. A genetic link may be possible since a family history is present in up to 39% of people with idiopathic hypersomnia. Your sleep specialist will ask about your symptoms, medical history, sleep history and current medications. You may be asked to wear an actigraphy sensor, which is a small, watch-like device worn on your wrist that can track disruptions in your sleep-wake cycle over several weeks. Other tests your sleep specialist may order include polysomnography. This test helps diagnose disorders believed to cause sleepiness. This daytime sleep test measures a person's tendency to fall asleep during 20-minute nap trials scheduled 2 hours apart. The test records brain activity, including the number of naps containing REM sleep. This daytime sleep test measures a person's tendency to fall asleep during 20-minute nap trials scheduled 2 hours apart. The test records brain activity, including the number of naps containing REM sleep. According to diagnostic criteria from the Diagnostic and Statistical Manual of Mental Disorders, you would be diagnosed with hypersomnia if you experience excessive sleepiness despite at least 7 hours of sleep and have at least one of these additional symptoms: A. Lapse into sleep several times within the same day. B. Get more than 9 hours of sleep and still don't feel refreshed and awake, or C. Don't feel fully awake after an abrupt awakening. Experience hypersomnia at least 3 times a week for at least 3 months. Report that the hypersomnia is causing significant distress or impairment in your mental, social, work or other areas of functioning. Different sleep organizations and psychiatric organizations have different classification systems and subcategories for hypersomnia. Secondary hypersomnia. Secondary hypersomnia means your excessive sleepiness is due to some other known cause. Diseases and conditions that can cause hypersomnia include epilepsy, hypothyroidism, encephalitis, multiple sclerosis, Parkinson's disease, obesity, obstructive sleep apnea, delayed sleep phase syndrome, multiple systems atrophy, myotonic dystrophy and other genetic disorders, mood disorders, including depression, bipolar disorder, seasonal depression. Sedating medications includes benzodiazepines, barbiturates, melatonin and sleeping aids, antihypertensive drugs, anti-epileptic drugs, anti-Parkinsonian agents, skeletal muscle relaxants, antipsychotics, opiates, cannabis and alcohol can cause hypersomnia. Withdrawal from stimulant drugs includes medications used to treat attention deficit hyperactivity disorder, can cause hypersomnia. Withdrawal from stimulant drugs includes medications used to treat attention deficit hyperactivity disorder, can cause hypersomnia. Hypersomnia due to not getting enough sleep, insufficient sleep syndrome. You may have hypersomnia simply because you're not going to bed and allowing yourself the chance for 7 to 9 hours of sleep, for adults. Perhaps you're not practicing good sleep habits, like avoiding exercise and caffeine within a few hours of bedtime, to help you get enough quality sleep. It's not caused by other medical conditions or a symptom of another medical condition. 4 conditions are classified as primary hypersomnias: narcolepsy type 1. This type of narcolepsy, also called narcolepsy with cataplexy, sudden muscle weakness triggered by emotions, is caused by having a low level of the brain and cerebrospinal fluid chemical, neurotransmitter, hypocretin, also called orexin. Narcolepsy type 1 commonly begins between the ages of 10 and 25. Narcolepsy type 2 has less severe symptoms and normal levels of hypocretin. This condition consists of recurring episodes of extreme hypersomnia. Idiopathic means no known cause, so idiopathic hypersomnia means you feel extremely sleepy for unknown reasons, even after a longer than adequate amount, 9 to 10 hours, of sleep. This includes things like establishing a regular sleeping schedule, having an environment that allows for sleep, cool, dark room, comfortable pillows and bed, and limiting caffeine and exercise before bedtime. Consider making some lifestyle changes to help improve the quality of your sleep and keep you safe and avoid injuries and accidents. Avoid caffeinated products, including coffee, cola, tea, chocolate, and various over-the-counter medicines, within several hours of bedtime. Although alcohol is a depressant and seems like it might help you fall asleep, as it's metabolized by your body, it causes awakenings and is often associated with nightmares and sweats. Although alcohol is a depressant and seems like it might help you fall asleep, as it's metabolized by your body, it causes awakenings and is often associated with nightmares and sweats. Ask your sleep specialist about what to avoid in terms of foods or specific medications. It may be helpful to talk to a psychologist or counselor and find a support group to learn to cope with the challenges of having hypersomnia. People with hypersomnia are often misunderstood as being lazy or incompetent, and educating them on this condition will help your relationships. It can cause you to lose your ability to function around your family, in social situations, at work or in other settings. It can cause vehicle accidents if you fall asleep while driving. Medications and lifestyle changes can help improve some symptoms in some people with hypersomnia.